Did I do it all right? No. So this is Israel Adesanya. He's quite possibly the most technically sound striker in the entire UFC, or really the entirety of MMA. The reason that I have him on here is because it's said that he has incredible hands, excellent hands. It's a boxing term or a striking term in general. So I thought it was a pretty good segue into today's conversations about the hands and the wrists and the joints that are associated specifically with our hands and our wrists. As you guys know, the hand and the wrists are going to be responsible for some of the most finesse movements that our body makes, right? Our muscle innervation, our motor unit numbers, all those things are going to be contributing to ultra fine movement. And with that, it's no surprise that all of the skeletal interactions, all of the joint movements are going to be a little bit more complex, and there's going to be a lot of things moving in order to create a specific movement. And that's super important, especially when it comes to sports, because think about how much the hands are used in finesse sports, as well as in general, more gross movement pattern, gross motor pattern behaviors like football, right? Think about archery, think about golf. Both of these sports, both of these movements require high levels of dexterity in the hands, right? You're having to have a great grip on a device. Here you have an individual that's using a finger trigger release. He's having to index that finger. He's having to have neural input, as well as he's in a complete contracted position, and he's having to hold that position while also manually manipulating a trigger. And then you have golfing as well, where if you don't break wrists at the exact correct time, then your shot's going to become errant. So it's incredibly important that we have fantastic motor control over our hands and our wrists. Even if you think about it in survival situations, or you think about it evolutionarily, humans or human-like forms have had to have fantastic grip and fantastic abilities to grab and manipulate the environment in order to survive. So that brings us to some of the more descriptive information about the hands and the wrist specifically, right? So this is going to be comprised of about 29 bones. We're going to have 8 carpal bones that are going to be in 2 rows of 4 inside of the wrist. I don't know if you can see where I'm pointing to. We're going to have 5 metacarpal bones that are going to be numbered 1 to 5 from the thumb all the way to the little finger. We're going to have 14 phalanges, 3 for each phalange. We're going to have proximal, middle, and distal phalanges as well. And then we're going to have sesamoid bones in there. And some of those, again, like you guys remember, some of those sesamoids may or may not be present in certain individuals. So if we're looking at the 8 carpal bones in the wrist, what I want you to see is that we have essentially 2 rows of 4 bones, right? So 1, 2, 3, 4, 5, 6, 7, 8. We're going to have a scaphoid bone, which is going to be this boat-shaped or navicular bone that's right here. We have the lunate bone, which is right here. We're going to have the trachetium, I can never pronounce that word, which is going to be here. We're going to have the pisiform, that's going to be sitting over top of the trachetium. We're going to have the hamate, we're going to have the capitate, we're going to have the trapezoid, and we're going to have the trapezium. One of the most commonly injured bones in the wrist is actually going to be the scaphoid fracture. And what a scaphoid fracture develops from is falling on an outstretched hand or falling on an outstretched arm. So when you go to catch yourself, go ahead and close your eyes and mimic how you would catch yourself, right? And that movement is how you catch yourself when you're tripping or you're falling. And it happens to be that where we're striking is right here on that scaphoid bone, right? So we're actually going to be striking down in that scaphoid bone. And it's oftentimes going to break if you fall hard enough. And what's really important about scaphoid bone breaks is that when it does actually fracture, the healing time can be super long, right? Sometimes as long as 6 months to make sure that fracture is completely disappeared. And it requires immobilization for 9 to 12 weeks, right? 3 to 4 months of immobilization just because you fractured a small bone in your wrist. Diving a little bit more into the carpal bone structure and kind of the position that they set up, because it's super important, is it's going to basically create a 3-sided arch. And if you look over here, you can see that you've got the carpal bones, 1, 2, 3-sided arch that it's creating. And when it kind of creates that 3-sided arch or that U shape, it's going to actually be creating a channel or a hole or a tunnel for which we can actually run tendons and muscles through. And the reason that we're creating that tunnel is because it's going to actually allow for us to create movement within our fingers that we wouldn't normally be able to have, because we're going to actually be changing the angle of the muscle or changing the angle of the tendinous attachments in order to exert the movements that we want. Now, the only problem is that we actually can develop carpal tunnel syndrome as a result of that. And because we're kind of forcing this musculature through this narrow hole, if we have any level of swelling from repetitive use injuries or inflammation from repetitive use injuries, which could be as simple as typing, it can actually become an incredibly painful experience because it ends up creating a pathological condition located within that tunnel because it's such an inflamed area, but it's such an important area. Sometimes small minor details can actually prevent that. So things like changing your wrist angle when you're typing or changing your wrist angle whenever you're doing repetitive hand and wrist movements like hammering a nail can all help to minimize the risk of carpal tunnel. Most of you guys are probably too young, but when we transitioned towards the internet, and I distinctly remember this, when we transitioned towards having internet full time, it actually, carpal tunnel made like all the rage, and it became hugely popular to be diagnosed with carpal tunnel, mainly because it just said that you were working a lot of hours on a computer. And how they came out with preventing that was they would actually they actually created these keyboards that would change the angle of your wrist to try to be a more ergonomical position. So if we're talking about bones within the wrist, then that means that we're also going to be talking about joints in the wrist, right? Because bones interact or interface at joints, right? The manipulation or the interaction of two bones is going to be a joint. So the wrist joint specifically is going to be a condyloid type joint. And what a condyloid type joint is, if you remember back to test one, or really I think it was even the first week, we talked about joint types. Essentially a condyloid is like this rounded flask with a cup. And what you can see is that the lunate and the scaphoid bone kind of create this cupping action with the radius. So the scaphoid and the lunate are actually sitting inside the groove that's created on the most distal end of the radius. And that's what allows for all of the movements to occur at the wrist. And that's flexion, extension, abduction, and adduction. In order to really get a handle on some of the wrist movements, I want you guys to go ahead and do the stupid thing, and I want you to point your hand out, right? I want you to go ahead and stick your hand out in front of you while you're listening to this. And then I want you to go ahead and maximally flex your wrist and see how much range of motion that you're going to get, right? It's about 90 degrees. And that's correct. It's probably 70 to 90 degrees. That's the average amount of joint movement for flexion. Go ahead and reverse that, and let's go extension, right? If you go in extension, you're going to have a little bit less. And that's exactly, I mean, you can see for me personally, I've got significantly less extension than I do flexion. Now, the other thing that we're going to have is we're going to have abduction and adduction because it's that condyloid joint. We get the four movements, right? And there's separate terms for adduction and abduction at the wrist specifically. So we're going to have radial deviation and we're going to have ulnar deviation. If we think radial deviation or ulnar deviation, I want you guys to think, what are the bones of the forearm? We're going to have our radius and we're going to have our ulna, right? And so if we deviate towards, and for an anatomical position, right, and we deviate towards our radius, it's going to be radial deviation. If we deviate towards our ulna, it's going to be ulnar deviation. And you should have about 15 to 25 degrees. I've got a little bit less. And you go 25 to 40 degrees, right? Like you should be able to have a significant difference in radial and ulnar deviations that occur. What the radial deviation is going to be equal to is abduction. What the ulnar deviation is going to be equal to is adduction, right? Because you're coming back to the midline versus away from the midline if you're in anatomical position. Getting into the hand now, let's talk about some of the joints in the hand. Each finger specifically is going to have three different joints, right? So we're going to have a metacarpal phalangeal joint. We're going to have a proximal interphalangeal joint, and we're going to have a distal interphalangeal joint. So the proximal interphalangeal joint is going to be the middle one. The distal interphalangeal joint is going to be the furthest one, right? Like this, I can't even do it. That one right there. proximal interphalangeal, and then our metacarpophalangeal, or MCP, is going to be the joint right here, right? So if you're on your screen, it's going to be this joint right here. So our metacarpophalangeal joint, I'm sorry guys, I struggle so much with words sometimes. Our metacarpophalangeal joint is going to be a condyloid joint as well. It's going to be responsible for 85 to 100 degrees of flexion, right? So we're going to take and we're going to try to bend those knuckles as far back as we can. We're going to flex them as much as we possibly can. And then it's also going to be responsible for extension. So we're going to have extension at the MCP joint, and we're going to have flexion at the MCP joint. For our proximal interphalangeal joint, or a PIP joint, remember that's that second knuckle, we're going to have a hinge joint or a ginglymus joint, and it's going to be responsible for flexion and just like a complete extension. So flexion, complete extension, flexion, complete extension. Our distal interphalangeal, so remember it's this third one right here, it's the last one. I actually just popped mine just now. Again, it's a ginglymus, so it's going to be a hinge joint. It's going to be responsible or able to flex 80 to 90 degrees. If you're one of those people that can like actually flex it by itself, that's incredibly impressive. But if I go like this, you can see that I can actually get 80 to 90 degrees. But then you also get a level of extension or hyperextension that can occur, right? Like we can actually go from beyond, we can actually go beyond 180 degrees or beyond a straight line for that joint at the very proximal end, or the very distal end, sorry. Our thumb is going to actually have two joints. So if you think about it, we have one joint and we have two joints, right? One joint and two joints. This first joint right here is going to be our metacarpophalangeal joint, right? So it's here, but it's here. It's also going to be a ginglymus joint, and it's going to be responsible for 40 to 90 degrees of flexion, right? So full extension to 40 to 90 degrees. The interphalangeal joint is going to be responsible for 80 to 90 degrees, and again, it's going to be another hinge joint, right? Now we get into the fun joint for the thumb, and that's the CMC joint, or the carpometacarpal joint. And that's going to be one of these unique saddle type joints. So if you look down here on the bottom right hand side, it's actually going to be a saddle. So it almost looks like you've got a horseback and a saddle that's going across it. What the saddle joint is going to allow for is multiple vectors of movement. And that's what allows our thumb the ability to go through so much motion, right? Have you ever thought about how goofy of a digit the thumb is, right? Like it can do so much, and that's exactly why. It's because of this hinge joint with the two ginglymus, or it's because of the saddle joint with the two ginglymus hinge joints on there. So the thumb is going to be able to go through flexion or extension. It's going to be able to go through adduction or abduction. It's going to be able to go into reposition, or it's going to be able to do opposition. And opposition is where you can actually reach out and touch your fingers. And that's why it's called an opposable thumb. In general, our wrist is going to be capable of flexion, extension, abduction, and adduction. Our fingers are going to be able to go through flexion, extension, and our MCP joints are also able to go through abduction, right? Like Dikembe Mutombo, no. And they're going to be able to do a couple other things. So when it comes to abduction or adduction, our reference line is going to actually be our middle finger. You thought I was going to do it, didn't you? Our reference line is going to actually be our middle finger. And so if we're moving away from that middle finger, then it's going to be abduction. If we're moving towards that middle finger, it's going to actually be a deduction. So if you take and you split, we can actually have our fingers moving in opposite directions, but still abducting or adducting at the same time. Super goofy, I recognize that, but I want you guys to stick your hand out. Bring your first finger away from your middle finger. It's abduction. Bring it back. That's adduction. Bring your little finger away from your middle finger. Abduction. Little finger back towards your middle finger. Adduction, right? Hopefully that makes more sense. You'll get it, I promise. When it comes to finger flexion, it is that come here motion, right? And then our wrist flexion is this motion here. Extension, and then our finger extension, right? So it's going from a flex position out. Abduction we just went over, but you can have wrist abduction as well. And remember, that's radial deviation is abduction. We can have abduction at the fingers, at the phalanges, as well as at the wrist. And remember, if it's the wrist abducting, then it's going to be radial deviation. We can have adduction. So our fingers can actually adduct, or our wrist can adduct. Our wrist adducting is going to be ulnar deviation, and our phalangeal adduction is going to be bringing them back to the midline. When it comes to the middle finger for adduction or abduction, I want you to imagine that there is a constant ray, if you will. So if that middle finger deviates from that ray, that's what's going to create that middle finger abduction or adduction. Fantastic. The next video, we're going to be getting into some of the muscles and the movements that they actually induce.